I am Darwin Barnes, and I am at EMTL Jamaica Fire Brigade, presently stationed at the Lake State Fire Station. Tonight I'm going to present on 3 types of shocks. First, I'm going to discuss the cardiovascular system and its relation to these types of shocks. The cardiovascular system, otherwise known as the circulatory system, is a network of vessels and organs responsible for delivering or circulating blood through the body. This is comprised of the heart, which would actually represent a pump, blood vessels, which would represent the piping through which blood flows, which would comprise of arteries, veins, and capillaries, and then you have the blood. This system delivers nutrients and oxygen to cells while removing waste products. If any part of this system becomes impaired, this would result in a condition known as shock. Shock is a life-threatening condition where the body is starved of sufficient blood flow to tissues and organs. This will cause inadequate delivery of nutrients and oxygen, which can result in tissue and cellular damage and eventually organ dysfunction if not properly treated. First, I'll talk about the cardiogenic shock. Cardiogenic shock will happen as a result of damage to the heart itself, the pump. This may occur as a result of a heart attack, myocardial infarction, where the heart, there is a blockage, so enough oxygen is not going through the heart muscles. So it's not going to the heart, so the heart muscles will actually die or become weak, so it's not able to function properly to pump efficient or enough blood through which the body requires. Then you might have a heart failure, CHF, congestive heart failure, where a part of the heart chamber is not getting enough blood, so the heart becomes too weak to pump or effectively provide the amount of blood that is required for the body's proper functioning. It also may occur as a result of a malfunction of the heart's electrical system. Then I'll talk about the distributive shocks. This comes under 3 headings: septic, anaphylactic, and neurogenic shock. Neurogenic shock occurs where there is a damage or injury to the spinal cord or the brain. Septic shock may be a result of an infection in the blood, which will affect the arteries. Anaphylactic shock, where there is a severe allergic reaction. This kind of shock causes irregular vasodilation, where the arteries become too wide, hence impairing the blood pressure in the artery, make it ineffective because it is not pumping efficiently because of the weak blood flow, because of the widening of the arteries. Then now we'll talk about the hypovolemic shock. This will occur as a result of low blood volume. The heart is not getting enough blood to function effectively. This may occur as a result of trauma, gunshot wound, or stabbing where there is significant bleeding. May also as a result of dehydration, significant loss of body fluids. This sometimes may happen in the pediatric population, in pediatrics. Some signs that you should look out for that will indicate shock. Warm, flush skin that may occur in the early stages, then eventually cool and clammy skin. Cool and clammy skin. Fast heart rate, fast heart rate, low blood pressure, confusion, dizziness, chest pain, nausea, vomiting, hives, wheezing, shortness of breath. That concludes my presentation. Thank you.